But what I'm glad the attention is coming around to is the fact that immunity doesn't start in the bone marrow. Immunity actually starts in the gut.
I'm so happy.
So probiotics are the basis. If you look at most cancer patients, when I started taking their diet charts down, about 95% of them have been on a diet which they didn't realize is sugar rich, and dealing with refined vegetable oils. And these two, if I have to summarize disease in a nutshell, it'll be vegetable oil and sugar. And because they finish the physiology of the body, they destroy the gut bacteria. Story's over. So try and avoid these starchy foods. I think people have been avoiding them now more because of what happened to that poor pizza delivery boy. Because there was initially a sudden surge in order-ins, and then now I think it's reached a flat line completely. So yeah, try and avoid that. I know people, it's difficult for people to make 3 meals a day, especially when they have to also do work from home, but try and avoid it as much as possible. That's immunity. One of the very crucial ways of judging how bad a person's innate immunity is by actually looking at their midsection. Central obesity is actually, forget the looks of it. Why does a human brain like a flat abdomen or a six-pack abdomen? Because it's intuitively telling you that this person has good health. Because central obesity the first thing it causes is insulin resistance. Now, insulin we think of as only a hormone that controls sugar, but it actually is the only hormone in our bodies that is a healing, developing, what we call an anabolic hormone. Everything else, all other hormones are catabolic, which means they destroy, or break down. This is the only building hormone in your body. So once there's insulin resistance, the insulin cannot exert all its actions. So any damage to your DNA, to tissues, etc., is just accentuated and repeated and not healed. And therefore, there is lowering of immunity. Therefore, there is worsening of gut probiotics. There's also plays a role in that, and increased blood sugar. And there's a higher susceptibility towards cancer. I did my analysis for the last 12 years, 2007 to 2019. For the dozen years that I've been back in India, I've got about 2,400 patients. Breast cancer, 79% are medically obese.
Wow.
So, it's not just the good looks. That's what I'm saying. Exercise is not just about giving you the looks. That's subjective. It's a side benefit, but it has, and the Tata Memorial published a paper 1.5 years ago on their breast clinic where there was central obesity versus the pear-shaped fat on the hips and thighs. And if you had central obesity, you had a 4 times greater risk of developing breast cancer than if you had weight on your thighs. So, you flatten that tummy. I think that's the best way to increase your immunity.
And is it also relating to visceral fat, basically?
Yeah, it's related to, so when the paunch comes out, it's essentially, it's not fat under the skin, but it's extra visceral fat, which is in the abdomen. And that's what increases. And by starving, and people say, oh, do this diet, do that diet, have a healthy diet, which has no sugar and no vegetable oil. Eat as many fruits and vegetables, or more vegetables and salads as you want. We can go on into this discussion about vegetarian versus non-vegetarian versus which is better, which is not better, but that's a separate topic of discussion altogether. But a healthy gut is the way to great immunity. Without a healthy gut, you will not be able to have great immunity.
I'm so thrilled that you're saying that, because right now, as of right now, we're releasing, a series of videos and content about immunity and its correlation to gut health. I don't understand how people are talking so much about immunity right now, and they are not speaking about gut health.
Yeah. It's crazy. Because if you look at all the Ayurvedic ways, the haldi and the this and the that, haven't they thought where it would act? Because you're ingesting it, and the only way it can act is in your gut.
Yeah.
Simple.
So I'm so happy you brought that up.